Hello and welcome to the Watchdog. My name is Vuyo Mvoko. Coming up on the show tonight,
we have therefore been undertaking engagements with social partners and other stakeholders on introducing measures that can make vaccination a condition for access to workplaces, public events, public transport, and public establishments.
COVID numbers continue to rise as the country braces itself for a fourth wave of infections. Health Minister Dr. Joe Phaahla is our first guest. Also on the show tonight, we'll be joined by the Deputy Minister of Social Development, Henrietta Bogopane-Zulu, as well as Katlego Rasebitse, who is the National Organiser for Sisonke National Sex Workers Union, to discuss the decriminalisation of sex work in South Africa. That and more coming up in tonight's episode of The Watchdog, which starts right now. Health experts say South Africa was not caught off guard by the new variant Omicron. It's confirmed it caused a rapid spike in COVID-19 cases in the country. The health department briefed the media and urged the country not to panic. The department says the country anticipated the fourth wave and new variants and is prepared to deal with its impact. The team also reiterated that the travel bans imposed on South Africa and Southern African countries and the closing of borders is baseless and ineffective.
Our own suspicion is that it's an attempt to try and, give a false sense of security from this pandemic to the citizens of those countries by thinking in a very simplistic way that if you have closed airports for people from particular countries, it's like this virus, it's kept in some container in those countries and carried by the citizens of those countries. So if you stop them, then nothing will happen. But we know that as many scientists have said that by the time this is revealed, we, from experience, by this time, we know that it is, by that time, the virus is already all over. But also, as we can see, even after this announcement, as it has happened before, positive tests of the same variant are being discovered in various. So we will continue to engage.
If we look at the global situation, we can see at a global level, the world has been through a first wave, second wave, third wave, and the numbers are now steadily increasing across several continents now. And so we may be at a global level entering a fourth wave. And we know that the variants have changed the COVID-19 endgame. We know that the variants have now led to a situation where we cannot simply hope that we can use public health measures and vaccines on their own. We've got to be, vaccines on their own. We've got to be looking at dealing with the variants as new ones arise. And so in changing that, our main concern, and why are we concerned about variants, is because of what we've seen in other countries and indeed in our own country. Here, I'm presenting here the first waves in India, Brazil, and South Africa. If you look at all three of those first waves, you get some idea of what we were dealing with back in the first half of last year. But look at what happened since. The Delta variant drove a severe wave in India, and I think we all saw the heart-wrenching pictures on our TV screens. We saw how the Gamma variant drove the epidemic in much of Southern America. And in our own country, we saw how the Beta variant drove our second wave and the Delta variant drove our third wave. And so we have some idea of the challenges we grapple with in dealing with each new variant.
As you know, DATCOP is a hospital surveillance system that was developed by NICD and the National Department of Health. And we currently have 408 public hospitals and 258 private hospitals that report COVID-19 admissions to DATCOP daily. When we look at admissions, the 7-day moving average nationally, after the peak of the third wave, we saw a decrease to low numbers, and we're starting to see a slight increase nationally. And what we see on the right is that the increase is evident in both the public and the private hospital sector. When you look at the daily average of admissions in the current 14 days and compared to the previous 14 days, we can see that there have been significant increases in Gauteng from 18 admissions a day to 49 admissions a day in the past 2 weeks, and a small increase in admission average in Northwest. But the other provinces are still not yet showing increases in hospital admissions or deaths.
We currently in Gauteng have 4,407 functional beds. Remember, Gauteng Health has got 18,344 beds prior to COVID. But this number of 4,407 were the beds that we had at the peak of the third wave. And we decided as Gauteng Health that we will take these resources to the fourth wave. It is from lessons learned. When we started with the third wave, we were at about 2,000 beds, and we have what we call a risk-adjusted, demand-informed strategy. So as the peak of the third wave went up, we increased until we came up to 4,407. We decided from the end of the third wave that we are going to continue to monitor these beds that we have been allocated to COVID-19, the 4,407, and these will be our resources that we will take to the fourth wave. So we have been preparing for the fourth wave since the end of the third wave.
Well, context there from a briefing that was held earlier today. Well, joining us now is the Minister of Health, Dr. Joe Phaahla. Good evening, Doc. Thank you very much for your time. I don't know if, you may have seen this. A short while ago, the U.S. President held a briefing where he praised, South Africa for identifying this variant as quickly as our scientists did, but then went on to justify the travel ban that the U.S. has imposed on us.
Well, I didn't see that. I was in the office. I just came to connect with you. But I can add that I was requested to meet with the Minister of Health yesterday. We met on Zoom at 6 o'clock. He came with a delegation to the Zoom meeting, including their director for the Center for Disease Control and Prevention. And they took the same approach of praising us, but then couldn't explain why they praise and punish. That was the contradiction even from their minister, the Secretary for Health and Human Services.
Who called the meeting, if I may ask, Minister?
No, they asked for the meeting.
Oh, okay. And what is it exactly that they wanted to establish? Well,
they said they want to explain their attitude, but at the end they said they were going to explain to us their approach, and they really pushed that we should meet. And I was still coming from the SANAC plenary in Durban, and they said, please, can we meet today? So I had to, as soon as I arrived from Durban in Pretoria, I had to quickly collect so that we could talk, because their embassy had been pushing that we need to, their health secretary wants to talk to me. And then when I listened, then they said, no, we just want to say we appreciate the good work and so on. We are with you, we are available. What can we do? So I said, what you can do is to stop the blockade, stop blocking the traveling. If you can reopen the travel between us and your country, that's all we need. We don't need anything more. And then they said they will discuss it.
How confident are you that they will reverse that decision anytime soon?
Well, we have no control, but we put our case, and they couldn't, they just said they understand when we said, look, but you say you're very complimentary of our scientists and our openness in line with the international health regulations, that you appreciate that and you support. But what you are doing, it's actually contradictory, and it's going to discourage other nations, and even our own people are questioning the wisdom of us being so open. But at the end, they said, well, they understand our unhappiness, our anger, because I said, look, everybody in this country is up in arms to say, was it worth it for us to be this open? And they said, well, we understand it. But what they couldn't do was logically justify why that step was taken, except to say that they will report back.
Do you regret?
As to whether, well,
do you regret that decision, with the benefit of hindsight, of course, given what has since happened?
No, we don't. Mm-hmm. We don't. You can imagine, Vuyo and viewers. You can imagine what the world would look like if indeed in this era of pandemics, Ebola, SARS, this SARS, that SARS, respiratory viruses, and every health expert tells us that this is going to be the pattern. There are going to be many more pandemics. Now, you can imagine if this is what the future is going to be challenged with, if nations of the world become secretive. You can imagine. So we not want to. We want to convince our people that not regretting. Despite what has happened, we should remain, confident in terms of, supporting the international health protocols, because at the end they are for the good of humanity. If we can all slide into secrecy, there's going to be a huge disaster.
Now, the director of the head of health in Gauteng, in that insert, spoke about lessons learned from the previous waves that we saw. How can you vouch for our system, this time around, given if this the trend we are seeing now continues?
Well, I think we have gone through the drills many times now, but as Dr. What's his name again? I'm just forgetting his name. The DTG of Gauteng, Gongwane. I think it's Gongwane. As he did say this morning, the difficulty with COVID-19 is that we know the pattern. At least now we know this is we can project what's going to happen in Gauteng as it unfolding now, moving from Tshwane to Johannesburg, starting to imagine Ekurhuleni and other places. So we can see the pattern. So working with the province of Gauteng, we're supporting them to make sure that, as he has outlined, all the various parameters of what needs to be ready are ready. But what is unpredictable is where is the next flashpoint. So we have to just get all colleagues in every province to be ready with all the facilities. So basically, what is the general pattern of what you're expecting, we are familiar with by now. But at what magnitude, in which particular area, and then, one time you find that is a particular district which gets hit hard, and the next is going to be but so at the end, as you were saying, in terms of the key issues, the bed capacity, the ICU, the high care, the consumables in terms of especially your oxygen and other equipments like ventilators, especially the key matter being also the human resources, the staffing. We know that these are the kind of expertise which we need to have. The only thing which you can't predict with accuracy is where is going to be the highest pressure. So there are those kind of details we're going to learn day by day.
What's your worst fear?
Well, the worst fear always is the question of severity, because what is apparent and what has been the pattern wave after wave, from alpha to beta to delta to now Omicron, from the first three, each one comes with higher transmissibility. But the question of severity, then is variable. But the problem with it is that, if it really combines high transmissibility and a huge virulity in terms of therefore leading to severity of illness, especially amongst the vulnerable groups, the older population, and in this case, those who are not vaccinated. A combination of high transmissibility and also high virulence, meaning more severity of disease. That combination could be very deadly to the extent that our systems may find it very difficult. So at least if as previously when the experts have been saying, as the virus carries on and on, it's likely to be highly transmissible, but less virulent and therefore less severe. If that expectation materializes, then we'll be able to cope.
Why was it so important today to emphasize over and over again that South Africans should not panic? Why was that an important message to, an important point to make?
Well, the point about it is that, when people panic, they can do all sorts of things which, rather than seeking proper behavior, you may see situations where, for instance, if it is said that the epicenter is this particular area, you might find situation where people start to move in bigger numbers to maybe areas where the disease doesn't seem to be in high numbers, and then destabilize the entire system, the social, the economic, and even the health, especially the health system. Those are some of the things which we just needed to, for people, rather than, to panic and then end up, ending in kind of reactions which may not be properly calculated. When we know that we do have tried and tested methods of managing, this pandemic, and to emphasize the fact that those tools are still available, they're still efficient if they are properly utilized, and focus on those. And sometimes, including also, we know there's also the fake news, where people may resort, they may be told about certain unproven remedies, which they may be promised for quick prevention and security. There may be some people who may take advantage of our people and promise them miracle prevention and safety, which may never really work. That's why we emphasized time and time again, including when the president spoke about the tried and tested methods which can keep us safe.
The president, of course, also announced last night that he is setting up a task team to look into making vaccination mandatory for specific activities and locations. Is that how soon do you think we may have to go that route?
Well, the team is still going to give us a report, hopefully in even a preliminary proposal. We hope to get it as early as next week. And high level, what we are looking at, it must be, they must look, the mandate which we have given them is they must look at progressive introduction. In other words, what are the areas of life which are not necessarily what you may call essential services, wherein it's largely for leisure and so on, but which are good for just social interaction. You know, people are very stressed these days. You do need those some of this, you know, like sporting, like social, you know, entertainment, and areas like those which are good for you know, not just physical, you know, health, but also emotional health, but which therefore it would be possible to say that, you know, for you to have the privilege of enjoying some of those, you need to make sure that in doing so you protect yourself and protect others. So that's really the brief, progressive kind of approach. Some of those, I mean, I've spoken to some people who run companies, and one you know, friend of mine who's got a business was telling me how they have managed in his business, where people, there was no, it was not compulsory, but within the workplace, for instance, if you are not vaccinated, you are not compelled, but you couldn't use certain facilities like your canteen. You have to collect your food and go and sit alone. Certain areas of relaxation during the lunch and tea breaks, if you are not vaccinated, you couldn't access, and things like those, and the requirements of further protection, including wearing a face shield if you are not vaccinated, over and above wearing a mask. And he was giving me an example that by doing so, slowly everybody ended up being vaccinated. So those are the kind of things which we're looking at to get proposals from the team.
Have we been able to gather any evidence that proves or suggests whether these methods have worked where they have been tried?
Well, I don't have a properly researched report, but just listening to colleagues also who have, and also reports from the experience, I mean, just like what is a small kind of example of what I'm telling you in terms of this particular business. But when you listen also to a number of countries, especially in Europe, it's widely used, and as a result, they've been able to reach already 70% and some even above 70% of coverage. And so indications and examples from other countries do suggest that properly managed, these mandatory vaccinations in a particular package have worked for them.
From where you sit, Minister, I mean, what has contributed to so much vaccine hesitancy in South Africa?
Well, I believe that it's really the overflow of huge, people, the information overload, and almost that South Africans, especially the younger age group, had at least a minimum of one cell phone with one or another form of social media, Facebook, Twitter, WhatsApp, and they are flooded, not daily, but minute by minute, with all sorts of information. It's not difficult to understand and explain, because the reason why you see that the 60 upwards, the population of 60 upwards I think by now we're just less than 65% vaccinated, at least with one dose, and upwards of close to 58% of fully vaccinated. And then as you go to 50 plus, you get also a much higher percentage, almost approaching 60%, just around 58, 59% of those who have at least one dose of vaccination, somewhere towards 55%, upwards of 50%, yes, of those who are fully vaccinated. And then as you go lower in the age, from 35 to 49, you start to struggle in the 40s, 40-something percent, 45% or so of people who have been vaccinated. As you go below 18 to 34, you get even in the 20s, we are still at about 26%. Now, it tallies with, the people who consume lots and lots of this information, fake information, some of it overload on their cell phones. So I believe that it's largely because people are really just overloaded every day with all sorts of contradicting information.
Now, I mean, people have obviously welcomed the unchanged lockdown regulations, but what happens, though, how likely are we to stay on this level throughout the festive period?
Well, it's in our hands. It's basically in our hands. We know the variant is there. It's got serious virulence. But if even without any, regulations, if we stay, in small numbers at home, minimum interaction with, unfortunately, with friends and relatives at this stage while the variant is raging, minimum, social activities in terms of end-of-year functions and parties, minimum all sorts of festive celebrations, all those, even if we have meetings and whatever, mostly in smaller numbers with the necessary precautions and largely social activities outdoors, all those things which we know do work. If we carry on and do a lot more that way, less of rush into traveling in big numbers, we might as well, it's probably inevitable. Many people have more than one home, the work area and the home area. And as industries slow down as we go towards the middle of December, it's almost inevitable. But, so at the end, I would say, as the president said, it's doable. We could avoid where there's got to be tightening of regulations to save lives. It is possible, but it's not given that we're going.
Should the numbers continue to rise, though, Minister? I mean, what other options do we have other than increasing the level of lockdown?
Indeed, if the numbers keep rising exponentially, and especially not just the numbers of positive tests and people testing positive, but if the numbers of people who are falling severely ill, and as reported this morning, the pattern, as the NICD reported on the .gov, which monitors admissions to hospital, linking it up with vaccination and the positivity of tests. Already, even though it's still early, even in this spike, as they said, they are seeing 87% of those who are admitted being those who are not vaccinated. So if the pattern, especially of bigger numbers of people needing admission to hospitals and our health facilities really get threatened to be overwhelmed, then there will be no choice but to increase the restrictions so that there is less movement, less social activity, so that we can protect our health services and our health workers. Because the last thing you want, nobody wants to see what happened earlier in the year in India, what happened in last year in places like New York. We're having a thunderstorm here, Vuyo, but at least the power is still holding. So no one wants to see those kind of pictures unfolding here in South Africa. So more than just the numbers, it's going to be the severity of illness and the admissions with serious illness in hospitals, which will determine how we move.
Minister, thank you very much for your time and insights this evening. The Minister of Health following, of course, the briefing that he and his team had a little earlier in the day. Now, a short while ago, U.S. President Joe Biden addressed a media briefing where he was asked about the travel ban that his country has decided to impose on South Africa. And here's what he had to say around that.
The reason for the immediate travel ban is there were a significant number of cases, unlike any other country, well, there are few around South Africa in the world. We needed time to give people an opportunity to say, get that vaccination now before it's going to move around the world. I think it's almost inevitable there will be, at some point, that strain here in the United States. But I don't think anyone's going to be reluctant to report.
U.S. President Joe Biden about an hour ago addressing that media briefing where journalists asked him about why they have taken this step to impose a travel ban on South Africa. Time to take a quick ad break. When we return, Deputy Minister of Social Development Henrietta Bogopane-Zulu and Katlego Rasebitse, National Organiser for Sisonke National Sex Workers Union, they'll be joining us to discuss the decriminalisation of sex work. Of no violence against women and children, the Deputy Minister of Social Development held a dialogue with a group of about 150 sex workers where she reassured them that the harm caused to sex workers while plying their trade needs immediate decriminalisation to protect the human beings behind sex work from exploitation, human trafficking, coercion, and other forms of abuse and discrimination. The Deputy Minister also offered some advice ranging from acquiring ID documents, access to health care, and reminding them of the rights of the children of sex workers. Well, she joins us now to talk us through that conversation that she had a little earlier. Good evening, Minister. Thanks very much for your time. Why is this matter so important?
Thank you very much, and thank you for having us, and good evening, South Africa. It's a very important issue because the biggest majority of sex workers are women. Yes, men are there selling the sex, also gay, lesbians, transgender. But if you look at the trade itself over the years, women are the dominating factor. And these are women that have children, these are women that have families, but also in the value chain of sex work itself, there is also the husband that's at home, there's the wife that's at home. And in our line of work, everybody in the value chain matters. And that is why this matter is so important.
Now, how legislation as it stands, is it even beginning, to take us in the direction that you would ideally want to see? No.
It's important for all of us as South Africans to realize that in South Africa, sex work is a crime. That's the first thing. Hence, decriminalisation is very urgent and it's very important. But in the same breath, it gives no one, not the police, not social workers, not health workers, the right to abuse and to, justify when women get raped and like you are a sex worker, you can't be raped, where people would call for sex and don't want to pay because they are taking advantage of the fact that the law has not been changed. And there is also just the basics of human dignity and the inherent human rights that sex workers are entitled to, irrespective of the trade they are involved in. And I think it's time that South Africa, we understand that sex work is work. I'm at work and I'm working.
Katlego, let's bring you in here. What are the lived experiences of sex workers, stories that, the people you work with may have or often share?
Some of the lead, thank you, Vuyo, and thanks to all South Africans. Some of the lived experience that sex workers have shared, throughout the experiences, it's around the human rights violations that occurs at the hands of the police, because we are in a country where, like now, the police are actually using sex workers as the resource in terms of making money. Like almost like the police are making sure that when they see sex workers, they see their ATMs, of which it's the behavior that us as the movement, we are trying to make sure that we sensitize and make the police to actually understand the Sexual Offences Act. Because when you remember correctly, it's only now that we have started rolling out what we call the sensitization programs, where these are workshops that we make sure that the police, they fully understand the sex work, its work, and then they fully understand the Constitution and how best that we can partnership with the police in order to make sure that certain things that the police are doing are according to order.
What do they do typically? Do they ask for money? Do they ask for sex?
What they do is they would ask for sex, and then they will detain sex workers for long hours, and then they would also make sure that, especially if it's women, they would make sure that they demand a higher amount of money. For example, the police, they would demand up to 1,000 rand. During in March this year in Soweto, we had a case where the police demanded 10,000 rand for a group of 10 sex workers, where those sex workers were given to say, if you do not pay this money by the end of Thursday, we would make sure that another weekly arrests are happening. So now sex workers, they have come to a point where they would pay the protection fee to the police directly. And not only that so it has also affected sex workers' kids, because you find the cases where sex workers' kids are being affected in a manner that just because she's a sex worker, and then you, as the minister, today we had a beautiful engagement with the minister. You strongly kind of rebuke this behavior of social worker literally taking away kids of sex workers because they felt that their mother does sex work. And she used an example to say, but if I'm a domestic worker, why don't a domestic worker, because the domestic workers, they will go away from their kids and then go work somewhere. Why don't they be investigated and the kids be taken away off? So these are some of the things that we still engage. But currently in South Africa, we're sitting in a country where the police are the number one abuser when it comes to sex workers, human rights violations.
Deputy Minister, are these conversations happening, at the level of the executive, for example? Have your department been able to actually engage with the police on this particular matter?
Yes, these discussions are happening at the executive level. If we can remind South Africa that the Minister of Justice had commissioned the Law Reform Commission to actually investigate issues around the decriminalisation or legalisation of sex work, which one would work for South Africa. The report came to the executive and it was opened up for public comment. And we launched on the 29th of October, we launched the second 5-year plan for the country, the second sex work strategic plan that actually outlines. And if you look at the first priority of the sex worker plan that the Deputy President of the Republic and Tate Mabuza, and the first one was launched by Tate Ramaphosa, who's the current president. This second sex worker plan, the first priority that government has to achieve is decriminalisation of sex work. And there's an agent call to the Department of Justice to say, can you fast track this matter, because it's been pending for a long time. And for us as social development, we're also saying we need decriminalisation as in yesterday, because it will enable us to deal with everything from those sex workers that want to voluntarily exit, and we'll be able to support them, and those sex workers that want to stay. But also it will assist us to keep children out of the sex work trade, because I want to make sure that we all understand this is about two consenting adults. Now, these conversations are important also because we want to partner with sex workers, because they are there, they will assist us to get the children out of the trade. There's also a high level of drug abuse in the sex trade, and we need to be able to offer rehabilitation and to support sex workers and their children who are also bullied at school. The minute the community find out your mother is a sex worker, you carry the title as well. And that is amongst the things that makes these conversations so important, because it comes with education and it comes with support as well.
But I mean, we always be criticized for having great plans but never getting to implementing them, because part of the problem is that we never put timelines to these things.
Well, I must be honest, I agree with you. I think we are the best country with some of the best legislations, but making it matter for South Africans is like, visiting the gynecologist. Women will know what I'm talking about. But in this sex worker plan that we launched, there are timeframes and there are indicators set. And there is also, for the first time, a budget set aside to support the plan, because the first plan was not supported. Now there is an allocation of resources to the plan.
Now, I mean, organizations like your Sisonke National Sex Workers Union, how do you, I mean, going forward, how do you sort of plan to work with them?
I need to say Sisonke, Sweat, they are not-for-profit organizations, so they are NPOs registered. And we do fund certain programs like advocacy, like the Future Mothers, because we are funding NPOs and we need to make sure that the awareness. Going forward, peer education is very important for us. Awareness is very important for us. Voluntary excision is very important for us. Support of sex workers and their families are very important. And those are some of the important programs. Family restoration, as well as community social mobilization, so that together as South Africans, we protect sex workers and we also respect the trade, because it's a business. And for as long as there's a customer, the service must be provided, but we advocate for safe sex.
Katlego, I mean, what are your experiences? What form of support do you need, for example? And how do entities like the Department of Social Work then get to, assist you?
The call for decriminalization, I think it's long overdue now. And I would definitely ask the Department of Justice and Correctional to actually intervene, because each time when we're asking for the report, they keep bringing it's almost 10 years old report. That was that's a very old report that we'll be bringing. And we would like to say it's high time that, we need to implement what is being said. Sex workers they've said it out. It's loud and clear. All they need is just a total decriminalization and the law reform to take its place. But we are aware that, somewhere in cabinet, there is something that happens and nobody wants to be held accountable, because each time when these calls are made, it all ends up in cabinet. As you know, when we launched our second NSP, that's when our decriminalization of sex work was removed. And up to now, as the national sex worker sector, we cannot even point between the ministers and the deputy ministers and all of the decision makers in parliament who actually removed decriminalization of sex work. But that was then, but we launched the new strategic plan now, whereby decriminalization of sex work appears 39 times. And when you look now into the the GVB plan, it speaks about 2024, of which for us to wait until
Okay, seem to be having. Okay, we seem to be having a problem with Katlego's line again. Deputy Minister, now, apart from, obviously, you, the police we spoke about, but when it comes to, like, things like ID documents, access to health care, and so on, are these conversations also happening with those departments, like your Home Affairs, for example, like your Department of Health, for example?
Yes. If you look at today's dialogue in Limpopo, we had all the departments represented. The Department of Health is just like the Department of Social Development, also, requesting the decriminalisation. But it's not only the police that the sex workers complained about. The sex workers complained about our social workers, and in social development, we need to train social workers because sometimes we take our own prejudice, our own moral standards and impose them on other people. So there are some of the conversations that came out today. But also they complained about the treatment that they receive by professionals in the health system. And we know that whether it's young people, whether it's disabled people, it's sex workers, somehow the attitude of health professionals, whether it's teenagers asking for contraceptives, there is that ill treatment that happens in our health facilities. And today in the dialogue, sex workers spoken about the fact that they need to go to the clinic in the community and the nurse there knows that they are a sex worker, because sometimes they don't even have to declare that they are sex workers. They are women accessing the health system. When they need PrEP, they will be denied. When the police arrest them, they will check their ARVs and their condoms. And this has been a discussion for a long time to say, how is it that one department gives condoms, which is the Department of Health, because we need to get to 0 new HIV infections by 2030. And then on the other side, another government department, which is the police, take the condoms as evidence. And this was also very loud, where sex workers said, look, this is continuing irrespective of the Minister of Health having called to say you cannot deny sex workers condoms, and condoms cannot serve as evidence when actually I have condoms, because I also am carrying condoms in my bag. But I shouldn't be harassed because I've got condoms. I'm a responsible citizen. And in terms of IDs, one of the areas that came out in the dialogues, whether it was in Amajuba, the different dialogues that we host across the country, you have foreign sex workers that then have South African boyfriends who makes them pregnant. And when they get the children, the boyfriend never wants to claim the children because he made the children with a sex worker. And what happens is that these children become undocumented because by virtue of you giving birth to a child in South Africa does not make that child a South African. The best South Africa does is to acknowledge the birth of the child. So it's important for us as the custodian of the rights of children, irrespective of how they landed in South Africa, that we educate sex workers, especially foreign sex workers, that for that child to even be looked at as a South African, the father who's a South African needs to be able to provide the necessary documents. So that is part of the conversations, because the rights of children also, irrespective of who the mother is, needs to be protected and upheld when they are on South African soil. So those are some of the, the calls we want to make to South African men to say, can you please take responsibility for your children? Whether they are born by sex workers, fatherlessness is becoming a crisis in this country. And South African men, please, for us to have a future, better man who's a South African man, it starts with fathers taking responsibility for their children. And we beg, can we please look after our children?
Katlego, it must be frustrating for you, what the Deputy Minister just described, where, the left hand doesn't know what the right hand is doing. You find that certain, departments do the opposite of what is supposed to be government policy, or at least accepted.
We did point as the movement address what you just mentioned, where literally the Department of Health will provide condoms and lubricants, and then justice will come through the police, would come and confiscate those condoms. So what we did was to call the Deputy Minister of the Police and also the Deputy Minister of Justice to do an outreach in Durban, where literally the police themselves would hand out condoms, because it doesn't make sense if another department is doing, what is good to the health of a human being, then another department would come and confiscate those condoms and use them as evidence. So after that outreach, things with the police, especially using condom as evidence, the police started to learn that, cannot be doing that because of it's inhuman, it's injustice, just to arrest somebody on the basis that they've got more than 20 condoms in their possessions. So the police, from that experience, that outreach we did, they learned a lot. But we do not only do that. We continue as the movement to making sure that we do training with the police on diversity dignity training, which is called the DDP, where like the police are being sensitized. For example, for the police to understand, if somebody say, "Officer, I am a transgendered woman," what do they really mean? Because some police from the academy level, this type of education or skills, they are not being taught. So that's why we have rolled out national research program to make sure that the police understand what is a transgender sex workers. The police can understand what's a lesbian. So these are some of the rollout programs that we have started rolling out. And we have indeed seen a positive response from the police themselves. Remember, not all police are bad policemen. There are those who are doing justice. There are those who are making sure that they put a more human face when it comes to the men in blue. And we're still pushing for a total decriminalization of sex work in the country. It's the decriminalization of sex work. It's the last human hope when it comes to sex workers. And remember, the law says only the seller of sex is criminalized, also the buyer, and those that are benefiting, meaning the children of sex workers themselves are also criminalized by the law because they benefit from the illegal money that is being obtained through what the state is called, it's a criminal offense, by if you say my body, my business. And certainly, these are like adults who are consenting, who are making sure that, they enjoy the service. And, we are all adults in South Africa. In 2021, we're still using apartheid laws, colonizers, the laws that came through the free ship, and making sure we oppress, especially a black female woman. It's saddening as the end of the country to say we are in 2021, we're still calling for decriminalization of sex work. It's very saddening.
Okay, and that's where we're going to leave it this evening. Thanks to both of you, the Deputy Minister of Social Development, Henrietta Bogopane-Zulu, and Katlego Rasebitse, who's the national organizer of the Sisonke National Sex Workers Union. That's our show for the evening. Do join us again tomorrow night.